Behavioral health documentation shouldn't take longer than the session itself. But between detailed notes, assessments, and billing requirements, providers spend hours documenting, often late into the night. That's time taken away from patients and from life outside of work. Sunoh's support for behavioral health documentation helps reduce note-taking time by turning natural conversations into structured behavioral health notes. Before the session, the provider simply selects behavioral health and hits record. Sunoh listens to the visit and automatically organizes the conversation into the right sections, including HPI, behavioral health history, assessments, plans, and session summaries. Providers can review, edit, and finalize notes directly into their existing workflow. Sunoh also automatically captures session time, assessments, and plans, and provides billing insights, helping reduce manual clicks and guesswork. The result is less time spent on note entry, fewer late nights, and more focus on patient care. Reduce the clinical note-taking burden for your behavioral health team. Make Sunoh part of your practice. Sunoh, supporting smarter clinical documentation.